where you are. And a special welcome to the virtual closeout meeting for the Rwanda More Happy Birthdays project. My name is Martha Bokosi. I'm project coordinator for ICM, and I've been coordinating this project with the support of my colleague, Dr. Florence West. And we are here together today to share the successes, but also the learnings from this project since we started implementing from 2021 in August up to June 2022. And for us to be able to share the learnings, we are going to go through the following agenda. We'll have an opening speech by Madam Josephine Murekezi, President, Rwanda Association of Midwives. We'll also have some remarks from Latter-day Saints Charities, but also acknowledgements from Mandy Forrester, interim lead midwife advisor, and also lead on regulation. Thereafter, we'll also share the achievements of the project. And we have the project team, including myself, Florence, Angelique Uwineza, project manager for this project, and Aram, and Rwanda Association of Midwives, but also Dr. Oliver Wazireti, National MEL consultant based at University of Rwanda. We also have Mrs. Kate Harbour, ICM project accountant, and Rorin Smith and Sarah Marie from Maternity Foundation. Then we'll have a session on questions and answers, but we'll have a closing session by Dr. Hassan Sibomana from Ministry of Health in Rwanda. So at this moment, next slide, please. Let me invite Mrs. Josephine Murekezi to give her remarks. Josephine is a president of Rwanda Association of Midwives, director of nursing services, maternal, child, and women's health, and is working at King Faisal Hospital in Kigali, Rwanda. Welcome, Josephine.
Thank you very much, Martha. Good afternoon, good morning, good afternoon, and good evening. I know that some people are just waking up. Thank you very much for joining us on this occasion. I do welcome the Minister of Health representative, Latter-day Saints Charities representative, International Confederation of Midwives representative, Maternity Foundation representative, distinguished non-governmental partners, hospital directors, higher teaching institution representatives, Rwanda Association of Midwives representatives, Obstetrics and Gynecologists Association representatives, Pediatricians Association representative, and the registered midwives and nurses, and all distinguished invitees, ladies and gentlemen. It is my great pleasure to welcome all of you on this virtual closure of More Happy Birthday project. I would like to express my heartfelt gratitude to all of you who sincerely committed to attend this event. This is an event that we started right from 50 happy birthdays, and we prolonged it to more happy birthdays. And we have been supported by Latter-day Saints Charities, of which we are very grateful, with ICM and the Rwanda Ministry of Health, of which we are very grateful for their support, especially the RBC that gave us a helping hand to achieve all our success stories. Our main objectives were to improve competencies of healthcare providers in maternity and neonatology services through innovative clinical trainings and mentorship, applying the low dose and high frequency approach. Also was to improve the culture of service delivery through evidence-based practices, to strengthen midwifery, nursing, and clients, family, and relationship through respectful maternity care practices, and also to support healthcare providers to analyze and use clinical data to improve quality care and service provision. Today, as we close this project, I'm happy to announce to you that we have achieved our goals, as I mentioned them, and this is evidenced by reduction of incident reports to our National Council of Nurses and Midwives. The number of incidents have reduced, and we are happy that the malpractices have reduced. Mortality rate has reduced, and we have many success stories to tell to our fellow healthcare providers. At this point, we are very happy that midwives and other healthcare providers have gained knowledge, skills, and their competence and confidence. And we have done this project in partnership with gynecologists and the pediatricians. So we have strengthened our relationship, and we are very happy that we are now working together as a team. We are conducting our mentorship procedures together, and we are connected on group WhatsApp, emails, so that we can really share information for one another. So we are very happy that this project has really helped us to improve on our working skills. And we are very grateful for the partners. RAM has really gained experience in partnership. We have gained experience in managing funds, and we have gained experience in monitoring and evaluation of our projects. So without taking much time, as we, only for 1 hour, we are here for only 1 hour. I text presenter, who is Mr. Dennis Muyenko from Latter-day Saints. Thank you very much for your kind attention. Thank you.
Okay, thank you, Mr. Josephine. And sorry for joining in late. I was using a wrong link. Yeah, so my apologies for joining the meeting late. So I'm speaking on behalf of the Church of Jesus Christ of Latter-day Saints through its humanitarian arm, Latter-day Saints Charities. We are very happy to have participated in this project, and we are happy to hear the results. That is the reduction of mortality rates, because this is one of the key focus areas that the organization in this part of Africa is focusing on. That is reducing mortality rate, and also targeting training to a lot of health professionals and strengthening capacity in a medical institution. So it has always been the goal of Latter-day Saints Charities to help those in need and to respond to where there is there is need and where it's actually mostly required. So we are very grateful to have been part of this and to support this initiative. And it's our hope that the results will continue even to be felt now and in future. Yeah, as you know, we are a faith-based organization, and our goal is to share the love of Jesus Christ with our fellow brothers and sisters. That's what drives us, and I believe we'll continue doing this even in future. Thank you.
Thank you so much, Dennis, on behalf of Latter-day Saints, for those remarks. May I now invite Mandy to give us some acknowledgement remarks on behalf of ICM.
Yeah, thank you very much indeed, and thanks so much for inviting us to speak with you all this afternoon. As Martha said, I'm Mandy Forrester. I'm currently the interim lead midwife, and it's really my pleasure to be here this afternoon as part of the closing ceremony. And I think what this piece of work is an incredible example of the collaboration, partnership, and success that can take place when people work together. So I'd really like to start with some thank yous, and particularly firstly to the Rwandan Association of Midwives and to the Maternity Foundation, to our sponsor who we've just heard from, the Latter-day Saints Charities, and also thank you to Mr. Eric Wunderlich. So we really appreciate that everything that you have done to make this project possible. Now, Lerda Health has been involved for the evidence-based and useful resource and long-standing support for midwives around the world. And I would also like to particularly thank Madame Josephine, who's just addressed us, and we know that Dr. Hassan is here from the MOH. And obviously from the ICM's leadership team and from the ICM, a really, really big thank you to Martha and to Florence for leading this work so expertly and with such good results as well. Now, as we've just heard, the project started as 50,000 happy birthdays and was such a success that it expanded to the More Happy Birthdays project. Now, I've just come off a global world safety, patient safety meeting. So it's music to my ears to hear that your incidents have reduced, mortality rates have reduced. And this is what everybody wants, is to make our care safer and more effective for the mothers and babies that we look for. And I think also what is really pleasing to the ICM is that this project actually addresses a lot of the professional framework. Now, as you know, we have a professional framework that we've recently updated, and it's all the elements that you need for a strong midwifery profession. Now, that's a really complex task. So we can't just educate and regulate, but we have to address everything that elevates midwifery and makes midwifery care the best it can be. So things like the philosophy, competencies, education, regulation, leadership, research, gender equality. So this project to me is a really excellent example of how, when using evidence-based education, you can actually affect the whole of what midwifery does. So the leadership skills that are highlighted were not only specifically designed into the project, but we can also see how confidence and leadership skills naturally increase when people are competently trained and have the confidence in their abilities to resuscitate babies. And the project also supported gender equality. So in the More Happy Birthdays project, the majority of people in the midwifery workforce are women, but they were encouraged to collaborate with a male-dominated or obstetric culture, and working together, look at the results that you've come up with. It's absolutely fantastic, and it's so exciting. Linking just the enabling environments to gender as well. So midwives must be valued and must also be able to work in an integrated and well-resourced health system with the tools to do their jobs, such as communication mechanism, transport, supplies, access to our obstetric colleagues and paediatric colleagues for consultation and referral. So the More Happy Birthdays project provided clinical care equipment, and these supplies were provided to target sites, thus supporting the environment where midwives can work successfully. So as of today, More Happy Birthdays is a huge success, and this success will affect people call me Miranda sometimes, will affect Rwandan midwives, nurses, doctors, and most importantly, mothers and babies for many years to come. So from the ICM, from the head office and from the leadership team, a really, really big thank you to everybody involved, and have a lovely afternoon.
Thank you so much, Mandy, for those remarks. We'll now move on to share the achievements, but before we do that, we need just to share a bit of history, how we came up to here, that we have been implementing the More Happy Birthdays. I will invite Florence to share with us this background. Florence.
Thanks, Martha. Oh, it's been such a journey, and I think most of us on the call are aware that maternal and newborn deaths largely occur at the time of birth and are preventable. The Survive and Thrive 5-year report showed us the way forward, and leading that was Laerdal Global Health, who partnered with ICM for the 10,000 Happy Birthdays project. And I think I saw Patricia in the meeting. So Patricia Tituala and Martha led that 10,000 Happy Birthdays project in Malawi and Zambia. And we learned a lot from that project, and also the Utstein formula, which outlined the 10 steps for a successful integration of HMS and HBS programs for survival of mothers and babies. Leading on from that, there was a short period of a continuation project in Malawi and Zambia, led by Martha, assisted by myself. And then the 50,000 Happy Birthdays project sort of overlaps with that in Rwanda, Tanzania, and Ethiopia. And due to the big successes of that project and the really wonderful collaboration we had with Latter-day Saints charities, we expanded that into the More Happy Birthdays Project Rwanda. There was a bit of a gap between the planning phase and the implementation phase due to COVID and other logistical issues. But we were very happy to have a longer planning phase, inception phase, so we could really plan out the project. And now we're really so proud of the achievements that the Rwandan Association of Midwives have achieved. And we want to know what's next after this. So just keep your thinking caps on, and we'd love your ideas at the end of this presentation. Thanks, Martha.
Thank you, Florence. Let's have the next slide. On this slide, we are just trying to show the objectives of the project, and we had 6 objectives. We'll not go into too many details, but just to highlight, because subsequent presentations will feature the actual activities and the achievements under each objective. But just to draw to your attention, we have 1, which is training of multidisciplinary maternal and newborn health providers. These are midwives and other health workers, but also training resources, provision of training resources to the facilities. Then we have objective 3 and 4, which looked at supportive supervision, but also monitoring, evaluation, and learning. And the number 5 was integration of the Safe Delivery app. And the 6th one, sorry, could I have the slide back, please? Thank you. And the 6th one is association strengthening. But just to point out that although there are 6, for us, the main overarching objective was number 6, which is association strengthening. Whether we conducted training, we provided resources, we did supportive supervision, we did the monitoring, integrated the Safe Delivery app. But by the end of the day, the overall goal was to strengthen association, the Rwanda Association of Midwives. So the subsequent presentations will focus on each one of them and see what we have achieved. Thank you. May I now invite Angelique, the project coordinator, to project manager, to take us through the training.
Thank you very much, Martha. I'm Angelique Wineza, Rwanda More Happy Birthday project manager, and I'm going to share with you our achievements through objective 1 and 2. First, our project had as the objective to train multidisciplinary maternal newborn health care providers from in-service and the pre-service area, such as nurses, midwife, and the medical doctors. And our target was to reach 1,500 providers. As our achievement, we even exceeded these targets. Over 1,600 healthcare providers were trained, and this gain for our trainees to have CPD point for their license renew. Also, it's improved communication and teamwork among healthcare providers in the Rwanda system and the referral of clients. Again, also confidence and the competence of healthcare providers were improved. Although some challenges were faced, such as COVID restriction, but as a good reason, we used a virtual means to reach and communicate with our provincial levels, such as emails, social media, WhatsApp, and calls. Next slide, please. Next slide. The second objective was to provide training resources and the clinical care equipment to all our implementation sites. The total sites were 112 health facilities, all were reached, such as 10 hospitals, 95 health centers, and 7 teaching institutions. So we ordered simulators from China. Those were shipped internationally and locally here. Some flip books, action plans were printed and distributed in collaboration with the Ministry of Health. Then now we have teaching corners in all sites, and healthcare providers, they are continuing low dose high frequency practice session. But as again, because of COVID, the shipping costs increased, which required the budget to be reviewed, and the process of shipping it delayed almost 4 months to reach here in Rwanda. And we shared with other partners to help our training going well. So I really thank you. That's all about objective 1 and 2 of our project. Over to you, Martha.
Thank you very much, Angelique, for sharing that information on objective 1 and 2. We'll now look at 3 and 4. May I invite Dr. Oliver Vaziretti, our MEL consultant, national consultant. She's based at Rwanda University. Over to you, Oliver.
Thank you so much, Martha. I'm Oliver Vaziretti. I'm a midwife lecturer at the University of Rwanda. And within RAM, Rwanda Association of Midwives, I'm in the monitoring and evaluation and the learning aspect for this project. I will be presenting objective 3 and 4, which is focusing on monitoring and evaluation for this project. We had a target to reach out 20 visits and 20 sites, and with a target of 2 visits to all the sites. We conducted the qualitative and quantitative data collection to monitor how the project was managed and implemented. And with the system and the approach that we used in the monitoring and evaluation, we have realized that there were less human error in collection and reporting data because we were mostly using digital tools. And we were also focusing and using HMIS data, and some of the health indicators were corrected from the register. We conducted some supervisory visits added in which was also contributing to quality improvement. And that was leading to improve the quality and the skills in using digital data collection tools. And it was having a positive impact in facility HMIS and the quality improvement systems. So it was giving a positive impact on the side of HMIS and the quality improvement. Next, please. Next.
Would you like me to speak to this one, Oliver?
Sorry, yes, I can see. And yes, this is an example of the Kobo collected tool that was using, and we're very thankful to Martin Boyce and Andrea Nov, who initially helped to develop with ICM and the RAM this tool, and it was converted in printable monitoring, education, and learning tools to digital and mobile device friendly versions. So these two were initially created by Andrea and Martin. In the implementation of the More Happy Birthday, the tool were revised and finalized by the ICM monitoring and evaluation lead person, who was this was Tucci, and she was helped with Florence and Rwanda, myself on the Rwanda side as a consultant in monitoring and evaluation. And in total, the participant had to cover 3 modules, and in each module there was a pre and post tests, and some pre and post confidence evaluation assessment, and they were also OSCE to conduct and be assessed by the master trainers. So this was an example of how the Kobo Collect tool was used, and it was very helpful to assess how the project was implemented, and it was how it was acquired by participants. Thank you very much.
Thank you very much, Oliver. And as you can see, also just to indicate that comparing from the paper tools that we're using before, it saves a lot of paper and it saves a lot of time for the trainers. Instead of using the paper, but this time we're using the digital tools. This is the Kobo toolbox. And we converted all the documents into the Kobo toolbox. So that's what we also achieved. And ICM is also looking at it and thinking this is one of the ways we need to advocate with our associations as a way of saving time and also improving efficiency by using the digital tools whenever possible. Thank you so much, Oliver, for this presentation. We'll now move on to the Safe Delivery app to be presented by Lauren from Maternity Foundation.
Hi, thank you, Martha. Thank you. Hi, everyone. I'm Lauren from Maternity Foundation, and I just have a couple of slides regarding the Safe Delivery app, which, in addition to using Kobo, was another new element to the HMS HBS training. So the Safe Delivery app is a global tool. However, for this project, we actually adapted it to the HMS HBS content for 3 of the modules. So that was BABC, preeclampsia, eclampsia, and HBB. So we aligned it to the content, but in addition, we added the practice sessions and the action plans. We know that through practice, we improve confidence and skills. It was aligned and it made it very easy to use and access the tools rather than the paper resources that are previously used within the HMS HBS training, but they could also be accessed. We had some really nice feedback from the participants about the app being fun, easy to use, and an extra component in the app, which I'll touch on shortly, is My Learning. So it's not part of the HMS HBS training, but it's something within the Safe Delivery app that we found participants really liked and enjoyed using. And I actually just pulled a quote here, which I think is really nice. One of the participants said they consider the Safe Delivery app like a Bible for midwives because it has the necessary information that every healthcare provider working in maternity care can need if they need to be refreshed on. The application is quick, good, and easy to be used by everyone. And I think that's really key there. It's easy and people are using it. So it's a great component to add to the HMS HBS training. If we can go to the next slide, please. Cool. So we just pulled a couple of insights from the usage patterns. So as we heard before, we trained around 1,600 in total, which was above the target. However, within the app, we actually saw almost 2,000 users downloaded and used the Safe Delivery app during the project period. And this is actually continuing to grow since the project has ended. And we think that the higher number is through word of mouth. It could be that those trained have told colleagues about it. So we're seeing those increases. And then if we jump down to the second graph, this is related to the practice sessions that we put into the app. So in total, we saw that 461 users actually accessed the practice sessions. And in the graph, we've broken it down by the 3 modules that we aligned within the app. So we can actually see that the preeclampsia, eclampsia, and the HBB were the most used practice sessions. I think here it's very important to note that this only refers to those who accessed it through the app. And we know that there's a lot of resources in HMS HBS, so other users could be using it in the more traditional resource approach. The other thing is that data only comes through when users are online. So I think that's a key component with the app data that we're looking at here. And then the final graph at the bottom, at Maternity Foundation, we have a couple of metrics to look at use. I'm sure you all know you can download an app. Do you use it? That's the big question. So we've defined some definitions. The top bar in the bottom graph is showing us who's actually used the content. So that's going beyond the menus. It's actually looking at the videos, the practice sessions, the action cards, and so on. And there we can see that almost 90% of the users have actually done that, which is fantastic. And then again, at Maternity Foundation, we have various measures, but one of our measures is looking at what we define as an engaged user. So these are users who actually use the app more than 5 times. And here we can see through the project period, 62% of our users have actually used the app more than 5 times in that meaningful way. So by looking at the videos, the practice sessions, and so on, which is higher than we see the average across the globe. So that's really great. We can see that through the training, through the peer-to-peer sessions, and through the cascaded training that we are seeing high usage, which is fantastic. So Florence, if we can pop to the next slide, please. And this is a little bit that I just mentioned at the intro, that within the Safe Delivery app, we have a component called My Learning. So this is a self-directed learning platform, which users can work through and progress through various levels. This isn't part of HMS HBS, as I'm sure many of you know, but what's really interesting is that we saw that 728 of the users signed up to My Learning, although it wasn't compulsory through the project. And then of those who've signed up, between 30 and 40% in the top graph, we can see have become experts. So that's the highest level that they can achieve within the 3 modules that we aligned the app to, which I think is great. And obviously we have data for the other modules, but for here, we're focusing on the 3 modules as part of the training. And then in addition to that, once you're actually an expert in all 14 modules of the app, you can open up an exam, and it's a 2-hour clinical exam, and you can become what's known as a Safe Delivery Champion. Again, this isn't part of the HMS HBS training, but we actually saw that around 10% of those who signed up to My Learning went all the way through the app, became experts, and actually sat down and took the 2-hour exam and are now classified as Safe Delivery Champions, which is really great and a very good learning for this project, because in other countries, we actually use that towards CPD points. So there's an opportunity there that could be discussed going forward. And I think that's really exciting. And then just to mention a couple of challenges and lessons. Oh, sorry, I've just seen a question pop up. Yes, My Learning's free. So the Safe Delivery app is a free application. You download it online, or you can have it shared via an APK, which is through Bluetooth. Once you have it, it's all free and it can be used offline. So it's a really, well, obviously, I think a very good tool, but it really helps, particularly in rural areas where we do a lot of trainings, both with RAM and ICM. So one of the challenges, as I kind of touched on, is data only comes through when the user's online. So I think through this project, we've captured some really fantastic data, but it's just to highlight we may be missing a couple of data points here and there, depending if the users went online. And another point is, again, as I mentioned, the Safe Delivery app is a global tool. So we have various versions of the app, whether it's aligned to countries, languages, or it's just a World Health Organization global version. One thing we did notice through this project is that although we made a specific app version, some users were actually using the global version rather than the specific Rwanda version. So I think the lesson there is just that we need to be a little bit clearer with our guidance and support when we cascade the training down to the other facilities, just to ensure that everyone's using the correct version to get the most accurate information. So I think that's it from our side. Hopefully I whizzed through in enough time.
Thank you. Thank you, Rorin, for that presentation. Now we'll move on to objective 6, which is on Midwives Association strengthening, and Florence will take us through. Over to you, Florence.
Thanks, Martha. It's a funny title for this objective because I feel like myself personally and ICM as an organization, we learned so much from this project and from Rwanda Association of Midwives and from the previous project, the 50,000 Happy Birthdays. So I feel like the learning has gone both ways, which is really nice. To concentrate on a few specific areas, we used the Midwives Association Capacity Assessment Tool version 1, which was completed in the 50,000 Happy Birthdays project at the baseline, midline, and end line. And we used the findings from that MACAT, which we call Midwives Association Capacity Strengthening Tool, from the MACAT tool to determine the areas based on what was reported by the association as needed strengthening. So apologies for some of the formatting, but they included things like monitoring and evaluation, project management, financial management, communicating virtually, creating networks and partnerships, advocacy, website, social media, etc. Memberships was one, and that all resulted in a stronger association. And what I didn't add there is actually a stronger ICM, which is really good. And Kate will speak to that a bit later, Kate Harbour. I'm trying to manage the waiting room as well as my slides, so excuse me if I look a bit vague. So just a few examples out of the many things that we worked on together. One thing was we really wanted to help Rwanda Association of Midwives be more financially sustainable and have a more solid form of revenue. So part of the revenue for the association is through membership. Now, this is just an example of the previous membership form from 2018, 19, 20, and before. It was a Word document. It had to be printed and filled and then uploaded or sent by post. And there was only one membership option with one fee. So we worked very closely together with the association project manager and Madam Josephine and the executive. And in the process of updating the website, we created together a fillable PDF membership form, which is easier to complete and has attracted new members. We linked the ID numbers to the regulatory authorities to support the Nursing and Midwifery Council track the workforce better. It could be filled electronically and submitted electronically. It doesn't need to be printed and scanned or sent by post. We work closely to develop additional membership categories and benefits. So there's a cheaper membership option for students and for retired midwives or supporters of midwives. And we developed together with the association benefits for membership to attract more members, and so they get some value for their membership money. And then more details down here to capture the banking details, which helps with financial management and invoicing, and a bit more clarity in the form about whether it's a new application or a renewal of an application. So that's just one example of some of the work that we've done together. And that's now up on the new and improved Rwanda Association of Midwives website, which you can find via your browser search. And we encourage, of course, all midwives in Rwanda to join the association, who will support you with your continuing professional development needs. I'd like to pass to Kate Harbour, who will speak a little bit about the financial management strengthening that occurred at the association. Kate.
Thank you, Florence. So this is Kate Harbour. I'm the project accountant and I work with ICM on various projects. I was actually involved, kind of came in halfway through the 50K Happy Birthdays project. So I've kind of seen some of the journey that the Rwandan Association of Midwives has been on and ICM has been on. There was quite a lot of learning that came out of 50K Happy Birthdays and also the kind of planning inception phase of more Happy Birthdays. So those learnings coupled with a review that CEDA did of ICM and the way we manage the sub-grant process, those kind of coupled together led to this kind of development of a project agreement that we've kind of set up with ICM. A lot of work went on that at the start of the implementation phase for more Happy Birthdays. And this was the kind of initial project that we kind of rolled this agreement and the various things that went with that out with. And so this project agreement, so a lot of work went on with it, and the kind of various things that were part of that agreement were like the budget, various templates for reporting, setting out reporting periods and dates of submission for reports, how we were going to handle exchange rates and any kind of gains and losses. But we discussed setting up a share drive so the association could upload all the supporting documentation for all the costs associated with the project. So all these things were kind of discussed right at before the project kind of got underway. So, you know, any kind of wrinkles were ironed out at that point. There was a lot of discussion that went on. So I think it kind of provided a lot of clarity, and also I think built quite a good relationship between the people involved in the project, the association, and with the team at ICM as well. And I think the team was a really kind of key part of this project as well, the way kind of we worked together from the outset, discussing things. So Angelique, and with the support of Thomas having a project accountant, I think at the association involved as well, really kind of strengthened the whole financial side of things for this project. There was very open communication, I felt, during it. The team, the association were very proactive as well. And this led in terms of the financial reports that we received from the association during the course of the implementation phase, being submitted on a timely basis, because we'd laid out in the project agreement when the dates were for submission of those reports. And the quality of the reports that we received are much improved from kind of what we saw during the 50K phase. So there was, you know, during the 50K, we used to go backwards and forwards several times, making adjustments, changing exchange rates, we had various amendments, and it'd be quite a time-consuming exercise. But with this, we were getting very kind of clean reports through, just a few little tweaks that were being received on a timely basis, which really made decision-making quicker, because we had a clear picture of what the financial situation was. Did we need to make any changes? For example, I think Angelique was talking earlier about how the shipping and clearance costs were much higher than originally anticipated in the budget. Because we had the financial figures up to date in a timely basis and kind of, you know, in a good state, they were kind of accurate figures we were seeing, we were able to make those decisions and kind of make the adjustments within the budget. And we did a change order. And then also when we went into a no cost extension period for May and June, again, we had the figures really up to date, so we could kind of do that forecast very quickly and turn that around quickly. And this kind of the efforts and improvements that we've been seeing during the course of this project, you know, we've kind of recognized it, I think, within the association and at ICM, but also ICM had its audit earlier this year, which was, you know, the More Happy Birthday project was underway at that point. And that they recognized it. They were really happy the way with ICM was kind of managing the sub-grant process, and commented specifically the way the RAM team had uploaded all the supporting information to the shared drive, and how it was clearly referenced as well, so you could tie it easily back to the financial report. So again, it made the audit a much smoother process as well, because we weren't going backwards and forwards between ICM and the RAM team, because all the information was there. It was all up front, easily accessible to, for the auditors and to pass to the auditors. So as I say, the project agreement and all those documents and the discussion and everything that went on at the start of this implementation for More Happy Birthdays was kind of the first time we really trialed this. And we are now using More Happy Birthdays as the project we refer to, go, okay, what do we do with More Happy Birthdays? What's worked there? It's been a much smoother project process. And we're doing a lot more sub-granting at ICM, and we're kind of using More Happy Birthdays as a bit of a case study. Next slide, please. So it's just a review in terms of the financials, where we're at.
10 minutes time notification. Thanks.
Okay, thank you. So I'm just going to quickly just say, in terms of where we're at the end of June 22. So the funding was just over $225,000 that we received from Latter-day Saints charities. We've spent 97% of it, so there's about just over 6K remaining. So we've got the final costs, from the closeout meeting and the finalization of the narrative report. So once that's in, those costs are in, we'll kind of see what the remaining funds are, and we'll have the discussion with Latter-day Saints in terms of what we decide to do with that money. Thank you, Florence.
Thanks, Kate. Martha?
Thank you, Kate, for that presentation. We now have a bit of time, like 5 minutes for questions and discussions. They are most welcome. Maybe you stop sharing, Florence, so we can see. Maybe there will be some hands raised. Thank you.
Yeah, that's easier for me too. I can't see when I'm sharing the screen.
Yeah, so it's open. In case you have a question, please just raise a hand, and there's one in the chat. You mentioned impact on mortality and incidences at the beginning of the presentation. I think this is when Josephine was giving the remarks. Could you share more on that? Okay, Madam Josephine.
Yes,
can
please.
you
Come again? I didn't hear the question.
The question is, you mentioned at the beginning that there is some reduction in the mortality and incidence at the beginning of the presentation. Yes. I think when you did the opening, so they're asking if you could share a bit of information on that.
Yes. The Nursing Council used to receive many incidents reporting in maternity that there was some malpractice. I remember there is a year where we received like 40 incidents on malpractice. And when I talk of malpractice, this means that there is where we had like a maternal death due to some lack of skills and knowledge. And there is where we had like a neonatal death because of malpractice. And when we could do the investigations, we could just find that this death was not intended, but it is just because there was lack of knowledge on preventing the death to occur. So as of now, we can even take a year without receiving any malpractice incident. That is what I meant. I hope I'm clear.
Thank you, Josephine, for that explanation.
Thank you.
There's also a question to say thank you very much for the overview of the project. What next? The project now has closed because it was for 10 months. Initially, it was for 8 months, and we extended for no cost extension 2 months, and now we have finalized. So it's officially closed, but this, as Kate mentioned, this is a case study, good case study, but we are hoping some other partners would be interested, not only in Rwanda, but maybe in other additional countries. But as of now, we don't have any more funding to say we are going to this country to extend or to initiate a similar project. But it's something that we are sharing around with various stakeholders. Thank you for that question. There's also a question from Yodit.
Yeah, we've got some hands up too, Martha. Just
okay.
Yeah. Can I ask a question, please?
Is that Jean-Pierre?
Yes, Jean-Pierre.
Jean-Pierre,
Yeah, thank you.
And then Mandy, and then Yodit. Thank you.
Yes.
JP, go ahead.
Thank you, and congratulations to everyone who initiated and implemented this project successfully. And the story are very interesting. And they are for sustainability and for continuity of the similar implementation. I'm curious to know, is there how those information or data collected from monitoring and evaluation will be are going to be shared to the other health providers like nurses and midwives, or is there any publication that are going to be produced after this monitoring and evaluation? And also, I'm curious to hear what are the strategies that are planned for the sustainability of those corner that presented, that initiated in the various settings that where the project has been implemented. Jean-Pierre I'm attending from Canada now, and I'm a member of Rwanda Association of Midwives. Thank you.
Thank you so much for that question. Florence, would you like to respond on the issue of publication and how we are going to use the info?
Oh, yeah. No, we've got such rich information. And Dr. Oliver Bazaretti from University of Rwanda, who is also the education expert at the Rwanda Association of Midwives. She and I are discussing publication with our Maternity Foundation colleagues. So certainly there'll be some papers submitted to peer-reviewed journals, so keep an eye on that. In terms of like more like grey literature, once we clean up all the reporting, we'll have it available on the International Confederation of Midwives website that you can access the project reports and summary there. I hope that answers your question, JP. But certainly, Rwanda Association of Midwives, with the support of the Society of Obs and Gynaes, is like perfect, what did Kate say, case study for other associations in the region. So I think they would be a really good resource for other people. And the other hand was Mandy. I'm just aware of the time. Mandy, and then Yodit, and then we might pass to our colleague from the Ministry of Health. Mandy?
I just think you're really short of time. So if you want to pass to another question, Florence, that's fine.
Thanks, Mandy. Yodit, you had a question?
Yes.
Hi.
Hi, how are you?
I'm good. I'm good. Nice to hear you.
You look nice. My question is that did they do specific research to know how many maternal morbidity and mortality was increased or was decreased after this project implementation, and how did they do this research or data collection?
Yeah.
It didn't mention by the
Yeah.
We didn't work in.
It's a good. Good
ICM project. You know that.
Yeah, good question. Good question, Yodit. I'll just answer that quickly to say that because the implementation period was so short, it was only 8 months. So in such a short implementation period, it's difficult, as you know, to attribute any reduction in mortality and morbidity to the intervention it's a very short project period. However, we do have some data, and with regards to health indicators, we did collect health indicator data related to postpartum hemorrhage, preeclampsia, eclampsia, and birth asphyxia. And when we map that to the usage data from the Safe Delivery app, we can see some nice correlation. So just keep an eye on the ICM website, and we'll be putting more information up there for your information. But yeah, good question. And I think, Martha, we might need to wrap it up, but I'm really excited to hear all the interest from people, and I'll try my best to answer the questions in the chat box while you introduce Dr. Hassan. Thanks, Martha.
Thank you so much, Florence. If there are any other questions, please just write them in the chat. We can also have a look at them at the end of the session. But at this juncture, may I hand over to Josephine to facilitate with the Ministry of Health on the closing session. Over to you, Josephine.
Thank you very much. We are very happy that the session has been going on well. And at this juncture, I wish to welcome Mr. Hassan Sibomana to give us our closing remarks. Thank you very much for coming, sir.
Thank you, Josephine. Good morning, good afternoon, good evening to everyone, depending on where you are. So as it has been said, my name is Sibomana Hassan. I'm the acting division manager in charge of maternal, child, and community health within Rwanda Biomedical Center. And it was a pleasure for us to be part of this dialogue, highlighting good achievement of the project. And as the Minister of Health, Rwanda Biomedical Center, we are very delighted to take this opportunity to thank the partners of Rwanda Association of Midwives, especially the Latter Day Saint Charities and the International Confederation of Midwives, for their support in saving mothers and babies' lives by providing support in terms of funds and training equipment during the More Happy Birthday project implementation. So in Rwanda, maternal and child health have significantly improved during the last 2 decades. This progress is attributed to a combination of different efforts that contributed to strengthening the Rwanda health system and making the quality of service accessible to the population, including outreach activities such as mentorship or reach the unreached population. To improve maternal health and the government of Rwanda in the context of its Vision 2020, but also the SDGs and also NST1, and also related to sector reforms in the policy, has been investing in the capacity building to improve the knowledge and the skills of healthcare providers to enable them to manage anticipated complication in maternal, child, and women's health. Rwanda has made significant progress in improving the health of women and children. And our maternal and newborn child health strategic plan 2018-2024, that healthcare services should be people-centered, integrated, and sustainable. And the Rwanda Association of Midwives has gained vast experience through this project in clinical practice, and I'm confident that the preventable causes of maternal and neonatal death will be reduced. So the Minister of Health would like again to express deep appreciation to everyone who participated in this achievement of More Happy Birth project. And as you know, we still have a high number of maternal and child mortality. So according to the last CDHS, you know that we still have a long way to go. We still have 203 deaths out of 100,000 live births. This is the maternal mortality, but also we still have a high number of child mortality. Now we are at 45 out of 1,000 live birth. So meaning that really this project was really needed. And we think that the skills gained from this project actually will continue to help the Ministry of Health to achieve the targets. Because as you know, our target is to continue to reduce maternal and child mortality. And as I conclude, I would like to thank once again all stakeholders and partners who worked tirelessly to make the project a success. Allow me also to invite you all to bring new projects so that we can sustain what we have achieved, but also we can achieve more. Thank you a lot.
Thank you so much, sir, for those closing remarks, and also a big thank you to the ministry for supporting this project during implementation. And we are also aware that the implementation was in the Ministry of Health facilities, and we are sure that the activities, the equipment and everything continues because it's within the parameters of the Ministry of Health. So thank you so much for your remarks. And this marks the end of our session. And finally, just to say a big thank you to everyone who has attended and listening to our achievements, but also there was what next. So let's keep thinking. We don't have the answer, but all of us have that assignment to say what next. The More Happy Birthdays is done, but what are we saying, whether in Rwanda or any other country? Otherwise, a big thank you from ICM and thanks for coming attend the session. Thank you.
Thank you, everybody.
Thank you.
Thank you, everybody.
Thank you, everyone.